You're watching PCTV Channel 17, proudly serving the Port Clinton City School District community. The following is a production of the Port Clinton High School Digital Media class.
Welcome to Time for Health. I'm your host, Rachel Fall, and we're very glad you've joined us. We hope you gain something from the program that helps you and your loved ones. We want to arm everyone with as much information as possible so we can all make good choices. This is not to take the place of regular medical care, so be sure to include your healthcare provider in on your plans and your conversations. And today, our guest is Christy Malakis. Thank you for being here. You're the pharmacy administrator at the hospital, and you've been on here before, so you're kind of a veteran now. So thank you for being here.
Of course.
And our topic today is Respect the RX. It's kind of a campaign that you put together a little bit. Very interesting to talk about some educational areas in terms of prescription medication. So that's what we're going to talk about today. I guess just kind of how did this come about? Why did you decide to do something like this?
Well, Respect the RX is actually an acronym that was developed, sort of some important points to remember about not only taking your medications, but some things to keep in mind about how to store them, when to take them, what to do when you have questions, those kinds of things. Okay. So it's just a nice little helpful tool to help you remember certain points.
Okay. And a lot of it, like I talked in the beginning, it's about a conversation with your doctor.
Definitely.
And it just kind of helps guide questions that you should ask or things that you should keep in mind, right?
Yep.
Okay. Well, just start.
Okay. Well, we all know RESPCT.
Righto.
So we'll start with the R. The R is the reason it was prescribed for me. And so one of the important things about taking medications is learning why you're taking them and having an active role in your own healthcare. So it's important to know that you shouldn't ever be afraid to ask questions. To get the best results, you want to make sure you've got a good role in your own healthcare, that you're taking part of it yourself, that you're not passing it off to anyone as much as you can, that you're having an influence in it. Now, you said asking your doctor questions. It's not only your doctor, but it's also your pharmacist.
Okay.
Your local pharmacist can help when something doesn't seem right. If you've got a question about a side effect, your pharmacist can be there to help as well. That communication is really essential in communicating. If you have a question about a side effect, how to take something, you want to make sure they have an active list of what you're taking.
Okay.
And giving your doctor all that information is just as important as you having all the information as well.
Okay. And so I have run into people, especially when you take a lot of medications. Well, what's that one for? It's a little white pill with a line in the middle. I don't know.
Right.
And it's hard to keep track when you're on a lot of them. But you need to know why.
So if a prescriber says, I want to put you on lisinopril, you should say, okay, why am I taking that? Well, it's for your high blood pressure. Okay, so make a note, because chances are you're not going to remember that when you get home.
Right, exactly. So wanting to know why you're on a medication,
right.
Writing it down if you have to. There's no shame in that, especially if you're on multiple ones.
Definitely, and a lot of us are at this point. As we age, we tend to have what's called polypharmacy. You'll hear that. That's kind of the buzzword now.
Gotcha.
Poly meaning many, pharmacy drugs. So we're all on a lot of prescription drugs nowadays, and they can be very beneficial for us. But at the same time, they can be harmful if we're not aware of why we're taking them, and then aware of what's happening if we're not taking them correctly.
Okay. So that's the R.
That's the R.
All right.
So then we go into E, which is explain usage. And that's usage is there a regular schedule? Do I take them as needed? Do I take them at certain times? Are there restrictions with certain foods, with alcohols? What's the best time of day to take them? Is it safe to crush them or split them in half? Should I take it with or without food? What if I forget to take a dose? These are a lot of questions that you might have that you wouldn't think about until, oh shoot, I forgot to take a dose this morning. Now what do I do? So these are questions that your prescriber can answer, your practitioner, or your pharmacist can help you with as well. So don't forget about your local pharmacist.
Your local pharmacist. Well, I'm just thinking about, I do Medicare Part D comparisons. People bring me the list of medications, but I need to know how many you take a day. For my particular purpose, I don't necessarily need to know morning or night or whatever, but those are like, you named like 8 things. I was like, I don't know. Like, can you crush it? And cut it in half, and if you miss a dose.
Right, and those are all things that when you have a and it's funny you say medication list, that's what I was going to mention next, is having a medication list is really a key to having all that information first. You want to make sure you document the brand and generic if you can. Having just the generic is helpful, but having both is good too, so we know exactly what you're taking. The strength, the dose, how you're taking it, when you're taking it is important. And then if you can name who prescribed that for you. That's helpful if you would happen to go into the hospital or a healthcare facility. If you've got the prescriber written there and we have questions for him or her, we can contact them and find out a little more information if we need to. So having that medication list is really important. When you enter into a healthcare facility, we do what's called medication reconciliation with that med list. And it's really important to have that accurate. We take that and then we compare that to any medications you may be prescribed while you're in the emergency room or as an inpatient. And we compare those to make sure that, number one, you're getting what you should be getting inpatient that you're taking at home, so that they're the same. And then number two, that if you're getting something different or new, it's not going to interfere with what you're already currently taking. So it's really important to have that list. At Magruder, if you get counseled by one of our pharmacists, we have a really great team of pharmacists that go out and talk to each patient. You'll get a little medication card that will have all that information that you can fill out. They also have those in the emergency room for you as well.
And the format doesn't, like if it's a piece of paper, if it's a printout from your pharmacy, it doesn't matter what it's on. Just write it down.
Right, that's right. Just make sure you've got the name of the drug, how often you take it, what the strength is, and then if you can have who prescribed it, that's helpful as well.
That's ideal. Okay, all right.
S goes into your symptoms. So when you're looking at taking medications, you want to know if you're not taking it regularly, when are you looking at taking it? So are you taking it for pain? Are you just taking it as needed? When we think about medications when they're used properly help us live longer, but in the same breath, I can say that medications, when they're not used appropriately, can cause harmful effects. So you have to be aware of, okay, am I taking this medication to help, but I feel really dizzy after I take it? And you want to be aware of those symptoms and be a good detective when it comes to how your body responds to taking medications and those symptoms that occur from them.
So paying attention to that
Exactly.
stuff.
Yep.
And do you recommend people to write things down? Like, I took it, I felt a little dizzy.
Definitely.
Write that down,
Keep a little diary.
When you go to the doctor, you're not going to remember that.
Right. Notoriously, patients are bad historians, mostly because we always think, I'll remember that for sure. But then you never do. Or when you get to the doctor, you've got so many things you want to tell your practitioner that you just forget those things a lot. So keeping a record of when I'm taking the medication, and then I keep feeling nauseous after I take it. Maybe it has something to do with that pill that I just started taking. Or I keep getting dizzy after I drink something after I've taken medication. Well, maybe you shouldn't be drinking alcohol. A lot of medications interfere with certain foods, certain beverages, so you want to be on the lookout for those as well.
All right. P.
All right, so RESP, we're on to practitioners. Practitioners is just a big word to encompass not only doctors, but physician's assistants, nurse practitioners, pharmacists. We want to make sure we're including all of them in our healthcare. So if you see a nurse practitioner for maybe your dermatology, if you see a cardiologist, if you see a neurologist, if you see a gastroenterologist, your primary care physician needs to be aware of all of those. And that healthcare then is a group effort. And if the primary care physician isn't aware of what your cardiologist is prescribing you, what your neurologist is prescribing you, then we see a lot of times where patients, if they go to a pharmacy, the pharmacist will see, well, you're getting that medication both from two different doctors. And then that's where we see problems. To that end, we'll also see if patients aren't filling prescriptions at just one pharmacy, it's hard to manage your health care. So I always advise patients, just go to one pharmacy, get everything there, you'll get to know the pharmacy team, and it's really nice to kind of maintain that relationship with your pharmacist, and they can really help you when it comes to managing your health care and your prescriptions that way. They can provide what's called medication therapy management, and it's just managing your therapies and what doses doses you should, be on, if something should be lowered or raised, and your pharmacist can really work with you on that. So practitioner is, you should really be the most important person, but it's including everyone in all aspects of your health care.
We do a program at the hospital called the Medical Notebook Program, and Dr. Cover always says that medicine way back when was, I went into the doctor's office, the doctor came in with his white lab coat, and he told me what to do and what to take, and I did it. And now you have polypharmacy, you have a specialist, you have, for all whatever kinds of things you got going on. You have nurse practitioners and and then some people do mail order, and some people do your regular retail pharmacy, and some people switch pharmacies because somebody had a coupon. And so he always talks about, the common denominator in all of that is you, the patient. So knowing your practitioners and keeping track of all that and writing those questions down.
Definitely. And your primary care physician can be the focal point of that, and keep, I see this person for cardiology, I see this person for neurology and gastro and those things, but it's making sure that everybody is aware of what your therapies are so that you don't have any cross, any kind of healthcare that's being managed in other than one location.
Right. And you can't always assume, the other thing was you kind of always assumed way long ago that your physician knew everything, knew all the medications you were on, everything, every test you had, but now there's so many other specialties and all this other stuff that they may not know, and so it's up to you to kind of share that with
That's
them.
true. And when you have a test done for your cardiology, your primary care physician might not even be aware of it.
Right.
So it's important to inform them and let them know what's going on, especially with your medications, that, hey, this changed. When we're doing that medication reconciliation, a lot of times we look for your primary care physician for an accurate list. And if you haven't notified them that something has changed, what we get from them isn't going to be accurate either. So that's really where that starting point is.
Awesome. Okay. We're about halfway through, so we're going to take a quick break.
Okay.
And we will be right back for the second half. From the hospital, talking about Respect the RX. Lots of things to keep in mind to make sure that your medications are managed properly, that they're the best ones for you, and that everybody's on the same page. So we got through RESP. Now we're ready for the next E.
The next E, right. The next E is the expected effects. Okay. Now, expected effects are what you would obviously expect to happen, but those could be side effects as well. So what are you expecting to get from this medication? Your blood pressure should lower, your cholesterol should lower, but also, are there things that you might anticipate happening? Is it going to make you drowsy? You're not going to take a Benadryl and then expect to stay up all night. Right. So those are kind of things you want to ask yourself, and we talked a little bit about being that detective in your healthcare. This also goes along with taking OTC medications as well. Are there any expected effects? And when we mentioned Benadryl, that's an over-the-counter medication. If you're changing medication dosage, if you're changing the way you take it, or have changed your diet at all, those could be effects that we want to investigate with your practitioner. And when we look at side effects, you want to be careful on not managing them yourself if they get too severe.
Gotcha.
So there are medications that if the side effects get so severe where it's causing trouble breathing, bleeding, heart, respiration issues, you want to call 911.
Gotcha.
That's always the first place to go. Otherwise, though, you can call your pharmacist, you can call your prescriber and tell them what you're experiencing, and then they might be able to help you manage those. Unfortunately, as good as medications are, side effects are sort of one of those unwanted accompaniers of those.
Yes.
So we do sometimes have to deal with them, but a lot of times the pharmacist or practitioner can give you helpful feedback on how to manage them.
Sometimes I've heard people say, I take a medication for this, and then I have to take another medication to deal with the side effects from that, and then a third medication to...
Right, unfortunately. But if it keeps you healthy and
Right.
keeps you living longer, then it can be worth
That's
it in the long run.
line. So things that I can expect things to pay attention to, and again, being a kind of an investigator on
Right,
that.
and it's just helpful to have a routine. I take this medication at the same time every day. A lot of medications they tell you to take at the same time every day. That's not necessarily because of a therapeutic effect, but because of getting you in a routine.
Remembering
And so if you take the medication at 8 a.m. every day and then at 9 a.m. every day you're getting a horrible stomach ache, chances are there could be something tied to your medication. So you want to sort of not only investigate that, but document that as well. We talked about writing those down for your doctor. So look at that and make sure that if there's a trend and you're experiencing the same thing, it's not always something you have to just live with. We might be able to lower a dose, try a different medication, and that's something you can work with your pharmacist or your prescriber for.
Do you recommend people read all the education that comes with the medication, like especially the side effects? Sometimes you're like,
Well, the side effects, unfortunately, the FDA requires you to list every single side effect that anyone's ever reported. So, a person could have had a headache that day when they took the medication, and that's listed now as a side effect. I think sometimes those can play with your mind a little bit, but I always think that information is valuable. So I will always recommend reading it. Just don't think too much about it. Read it, and there's some good references in there. But your body is the best reference for you and paying attention.
Knowing what your normal function is.
Definitely.
And paying attention to that. All right. C.
All right. C is an important one. It's concerns with controlled substances.
Ooh, sure.
So a lot of times if you have hurt yourself or had an accident, you might be prescribed a narcotic for pain. What you want to think about is there the potential to cause addiction, not only for you, but you want to think about, is there any access that somebody in my family could have to this medication?
Gotcha.
When you look back on patients that have suffered from addiction, a lot of times it started with having access in a medication or in a medical cabinet in a patient's home, in a family or friend's house. So we want to be very careful of how we're storing those substances, not only for family and friends, but also for children. Just keeping it out of the reach in a safe and secure location. In medications in general, we want to make sure that we store them in a cool, dry place.
Gotcha.
Where do you store your medications, Rachel?
On my dresser.
Okay, that's not bad.
I only take vitamin D, so that's
Okay. I was waiting for you to say you put them in the bathroom, because then I was going to yell at you.
No.
The bathroom is not a good place to store medications, and that's because of the humidity from showers, and it's warm in there. You want to pick a cool, dry place, so somewhere where you're not going to have that temperature differential. And it's really important also that if you do notice any kind of overdose or a medication where you want to call poison control, that they're always there to help you. And that number is 1-800-222-1222.
Okay.
So it's one of those that's kind of catchy, easy to remember. So.
And this is something that not all pain medicines are narcotics, is that right? So they're not all prone to causing addiction.
Right.
And that's a conversation that maybe one of those questions to ask your doctor.
And there's a difference between having an addiction to something and having a tolerance. So you may notice that you could take one Motrin and that would relieve your pain, and now you have to take 2 Motrin. You're building a tolerance. An addiction is when you need something and it doesn't require you to, it doesn't help you relieve pain, but you are requiring it to function. And it may help relieve your pain as well, but you're growing an actual addiction to it.
Gotcha.
So that's why those controlled substances are called scheduled or controlled substances,
Gotcha.
those narcotics. And that's different from the over-the-counter pain relievers like Tylenol, Advil, aspirin even.
Okay, those are not addictive.
Those are not addictive, no.
Okay.
Now, you do want to, caution when
sure.
you're taking them, but they do not have an addictive quality to them.
Okay. And I mean, that controlled substance is probably a whole other topic for a show.
I'm sure I could come back and we could talk about that, definitely.
Because you have to be very careful about, I know when people transfer to a facility, things have to be written a specific way and all that kind of stuff.
There are restrictions with which schedule. Norco, or what Vicodin is, that has moved into a different class, so there's no refills on that now, and
Gotcha.
Percocet's in the same class. There's that's called a Schedule 2 or a C2. Schedule 3, 4, and 5s have restrictions on how many times you can refill. Within 6 months, you can only refill them 5 times. So there are definitely a lot of restrictions, and again, we could spend
An entire
segment on there.
We will move on to T.
Okay. So RESPECT, T is fittingly, it's time to stop.
Okay.
And that's stop taking your medication. Is it time to stop from the therapy, or how do you get rid of the medication when you're done? So kind of 2 different questions there.
Okay.
A lot of medications, we've talked about polypharmacy, you'll sort of be taking those lifelong. But some medications, like an antibiotic therapy, a pain therapy, you will finish and be done with. I will do my classic reminder, always take your antibiotics till they're done. I won't throw my mom under the bus again today and mention how she never finishes them. But I know she's not watching, so that's okay. So when we finish a medication therapy, and maybe you're taking a pain med and you're taking it as needed and you've got some left over, it's important to get rid of those medications and not just hold on to them because you'll think you'll need them again for later. Medications do expire. They're not good forever. Over-the-counter medications have that expiration date, and your prescription medications right there printed on the bottle for you. And some medications can actually become harmful after the expiration date. Okay. There aren't many, but there are a few, and you just want to get rid of them and not have to worry about it. So the best way to get rid of your drugs, actually, we're lucky here in town for prescription drugs. We have a drop box at the police station. So that's really nice to have.
Yes.
We've utilized that before. But if you don't have access to that or don't want to go there, another safe way to get rid of them for the environment is to, what I always do is get like a Tide jug or a detergent bottle, throw some kitty litter in there or throw some coffee grounds in there, and then throw the tablets, pills, whatever they may be in there. That will degrade them, inactivate them, and then you can throw the whole thing away. It'll be safe for the environment. The other thing to remember is if you've got a prescription vial, take the label off, shred it. If you have access to a shredder, black it out, whatever you can. We're in a society today of having to protect your health information.
Right.
That's the newest identity theft trend, is health information.
From prescription bottles.
From
lots of
anywhere.
ways, lots of places.
So we want to make sure that you're protected that way.
Okay.
So that would be my recommendation, is getting rid of that out of your bottles. And kind of back to when you're storing your medication, I forgot to mention, you want to keep those bottles, keep your medications in those amber bottles. They're that color for a reason. It's not just because it's so pretty. That sort of protects it from light. A lot of medications are sensitive to light.
Okay.
So if you happen to take them out and if you take them out and put them in those pill reminders, those have the same effect. So those are fine. But if you just take them out and put them in a mug, or I don't know what you're doing, but that won't have that same light protection, and the medication can become ineffective. So you want to make sure you store them in those original containers.
Also, time to stop. I'm glad you brought up the antibiotic thing, because you stop when it's done.
Yeah.
Not when you start feeling
Not
better.
when you, right.
And I think are there other medications, like a blood pressure medication? Well, my blood pressure's fine. I could just stop taking that. Or I'm on an antidepressant. I feel fine. I don't need to take that. No. Just
don't do that. No. And I've heard of people say, well, I feel a little dizzy today, so I'm going to take a half tablet. Don't self-medicate. Talk to your doctor.
Okay.
You are not the person that's prescribing that for you, so you shouldn't make those decisions for you. Yes, you should be invested in your health, and that's great that you're aware of how it makes you feel, but you should talk to your doctor before you decide to take any sort of chances on having a tablet or taking 2 or whatever it may be. Talk to your prescriber before you make any of those changes.
Okay, awesome. We only have like a minute or 2 left, but I know you brought some tips for people traveling, and with it being
definitely
winterish out.
Yes, and if anybody's getting out of the country, I'm jealous. Take me with you. But just some tips to keep in mind. If you're leaving the country right now, you want to make sure you keep all your medications in their original containers, especially given what's going on with our security threats. It's important that they're labeled and they have what it is and the contents and the name all on there. The other important thing is to remember you keep it in your carry-on for a couple of reasons. Number one, that cargo area where things are stored is not climate controlled, so bad news can happen in there.
Right.
Number two, what if your luggage is lost? You're going to have a hard time, especially if you're leaving the country, getting any prescriptions refilled. So you want to make sure that you carry those in your original bottle. Now, if you've got it already in your pill minder, you can take that along with you. But I would have some labels reprinted of what it is that you've got in there.
Okay.
Your pharmacy can do that, so that if TSA has any questions, they can look at what you've got.
Gotcha.
Nobody wants to be the person stopped at security with a box full of white pills. So let's just make sure you're all safe this holiday season traveling.
Awesome.
Okay?
Thank you very much.
You're very welcome.
All right, we're going to take another break and we'll be right back. And we're back. I want to thank Christy for being our guest today, shedding a lot of light, some awesome things to keep in mind in terms of keeping track of your medications, being the investigator, being the leader of your health. Again, it's the Respect the RX campaign, so to speak, and we have these awesome informational cards in the lobbies of the hospital. So if you want some more information, something to carry with you or to share with somebody, they're available in the lobbies at the hospital. So awesome information to keep in mind for you or for somebody else you might know and love. If you ever have feedback about a program or a suggestion for a future episode, please let us know by sending a note to Time for Health, 615 Fulton Street, Port Clinton, Ohio, 43452. Or you can email Mrs. Pelz at the high school, cpelz@pccsd-k12.net. So think about this information that we learned about today, whether it's something you can implement or share with somebody else, please do so. And until we meet again, I encourage you to make time for health.